So, welcome friends. This is Dr. Vineet Sehgal, and I am your ophthalmology educator in Unacademy NEET Plus PG platform. So, today we would discuss about the AIMS new pattern questions, and the topic of the day is match the column type of questions. So, basically, in match the column type of questions, you can get a set of diseases in one column and its manifestation in other columns, or you can get other type of questions where they have told you about surgeries in one column and the respective diseases in other column. So in the match the column type of sessions, which would be a 2 hour session, we would be discussing about the various type of questions from each chapter of ophthalmology. So let's have a look. So let's say here we have signs in one column, which are Salus sign, telangiectasia, drusen's, and recurrent vitreous hemorrhage. And in other column we have various pathologies like Coats disease, age-related macular degeneration, hypertensive retinopathy, and Eales disease. Then we have your options where A is matched with the 1, 3, 2, or 4. Okay, so we have to do these type of questions and have to remember that we should not waste too much time here. So what is the trick of doing these questions? Let's discuss. So let's say we have Salus sign. So Salus sign, we see it in hypertensive retinopathy. So A goes with 3. Telangiectasia, that are the dilated vessels where we see it in Coats disease. So B goes with 1. Drusen's in dry AMD. So C goes with 2, and recurrent vitreous hemorrhage goes with the Eales disease. So we have the sequence as 3, 1, 2, 4, which matches the option C. So the answer here is C. So another question where you have signs in one column and pathologies in other column. So let's do it. So Munson sign, where you see it in keratoconus. So A goes with 4. KF ring, where you see it in Wilson's disease. Satellite lesions, where do you see? You see it in fungal corneal ulcer. Geographical ulcer and dendritic ulcer, where you see it in herpes keratitis. So your sequence is 4, 2, 1, 3, and your option D is correct. Okay, so we move to the next question where you have the signs in A column and pathology in other column. So past pointing, where you see past pointing, the past pointing, you see it in paralytic squint. So A goes with 2. Where you see null point, where the nystagmus is minimum, so you see it in nystagmus. So you point it 4 here. High AC by A ratio, where you see it in esotropia. Bilchowski test you see in fourth nerve palsy or superior oblique palsy. So your sequence is 2, 4, 1, 3. So answer here is your C. Move to the next question. Blowout fracture. So in blowout fracture, what do you see? You see the trapdoor sign. Okay. So here the blowout fracture goes with 4. Thyroid ophthalmopathy, you see Coke bottle sign where your tendons are not involved but your muscles are involved. Central serous retinopathy in FA, you see smokestack appearance. Okay, in angle closure glaucoma, you see Vogt striate. Okay, so central serous retinopathy goes with 1. So your sequence is 4, 2, 1, 3. So your sequence is 4, 2, 1, 3. So your D is the answer. So not only it is important that you do the question correctly, but also important is that you do not waste too much time in these questions. So basically in our 2 hour session, we would be discussing around 50 questions and this would revise you around 200 topics. Okay, so match the following. You have science in column A and your pathology in column B. So ERG, basically where you use it in retinitis pigmentosa. So A goes with 3. CT scan, where we do it in blowout fracture to rule out any bony injury. So 3 goes with 4. FA, you do it in retinal vascular diseases, and OCT, you do it in macular edema. So 3, 4, 2, 1. Okay, so here, because this is a 5 to 10 minute session, so I'm going a bit fast, but basically what I want to tell you is that these questions are not very difficult questions. Only thing is that you have to apply your mind and apply it quickly. So please register for the a medical marathon through MCQs for NIMANS, AIMS, and PGI, where we would discuss various new type of questions. Use my code Vineet Sehgal RPC AIMS 4415 to get 10% off on the complete package. Let's crack it.